And what about on the fundraising side? Do cases like today's, Supreme Court hearings like today's, help you raise money?
I mean, we've been fundraising for our entire existence, Planned Parenthood. So they do help a little bit, but I think overall, our supporters have been with us. Most of our supporters have been with us for decades. They know how important this work is. I think recently what we've seen support for is we just call it patient assistance funds for those patients who really have to travel and have a hardship. And we have patients, imagine driving 6 hours from Boise to Kennewick, Washington. That's a big hardship. Some of them have to leave their jobs, take several days off from work, often find daycare for their children, and so it just can become a big hardship. So we've had a lot of donors who've stepped up just to help provide patients with funds that they might need to take this break from their normal lives to get the health care that they deserve.
Now, I asked you kind of what happens if the court rules in favor of Idaho and this continued ban. On the flip side, how does the on the ground situation change if the court rules in favor of the United States here?
Yeah, I think it helps. It'll be interesting though. The rhetoric in Idaho is so hostile already. And I think just the absence of doctors not being able to have the freedom to do the best care that they want. I think, Idaho has gone way too far with the total abortion ban. So I think it'll help a little bit for those patients who are really in an emergency and cannot get to Washington. But overall, I think it still puts Idaho in a place. It doesn't bring maternity care services back to some of these hospitals that have had to close those down, and it doesn't bring some of these doctors who have already left. They left mostly because of Dobbs and the restrictions to their care. So I still think it puts Idaho severely behind when it comes to public health and making sure that they can keep their residents safe.
In some other states, we've seen special ballot measures for voters to vote on abortion. We've seen referendums. We've seen some legislative solutions in other
Yeah.
states. Is there a legislative solution on the table in Idaho? Is there the potential that this can be solved or fixed on a legislative level?
I think we just to be realistic, we have years of education still ahead of us. I think the Idaho electorate is very conservative. I think often uninformed and doesn't. We need to do more work just to continue to educate voters and make sure they know what's at stake, so that they can elect officials that will basically change these laws. So yeah, there is work to be done. There is no legislative solution right now that's we think has a viable chance in Idaho, but we're not going to give up, and we know that there's some important work ahead to make that happen.
What are you looking to next? I mean, today was a big day in the court, but what is on your radar for the next month, 3 months, 6 months, etc.?
I think that November election, that is on our radar. We have to do well and win. I think we've seen what has happened with these attacks across the country in various states. We're really lucky to be in a state like Washington where we have such strong support. But federally, we need to have a really good election outcome. So we want to make sure we continue to take care of patients day in, day out. Our staff do a great job of that, but also do everything we can to make sure we educate voters and they can make the right decision in November.
Is there anything you would say to the Forbes national audience, right? We don't just have viewers in Idaho or Washington, about why this case and why the situation that you're overseeing matters to them?
I would say 88% of women say that they support access to abortion in these kind of situations. This is so sad that we're even having to debate this. This is really what we consider basic care. When you talk to the medical community, this is so obvious that we should be able to let doctors practice within their full scope and do the best that they can for patients. So I think, the message we want to make clear is that this is really sad that Idaho politicians are playing games with people's lives and their ability to have children in the future. And it's sad that that's putting the burden on healthcare providers in Washington to be there in circumstances when we really shouldn't have to do that. We should be able to focus on other things like expanding primary care and expanding mental health and other types of programs. And instead, here we are left fixing some of Idaho's really sad problems.